hurdle has been cleared for the youngest Americans to finally be eligible for a vaccine.
It has been more than a year since adults could get fully vaccinated. Meantime, families with young children have continued to weigh the risks of COVID in their daily life. Vaccine Central team member and the only TV health reporter, Haley Hernandez, is here now with those details. Haley?
Yeah, so in the time that adults have been eligible for a vaccine, COVID has become the leading cause of hospitalization in this young age group, according to a doctor I spoke with at UT Health. Now, it remains true that in comparison to adults, kids don't get that sick, but they can still get sick and develop long-term complications. Today, the FDA was challenged to weigh those risks of the virus with potential risks of a vaccine. Today, the FDA committee voted on two things. First, the Moderna vaccine for children 6 months through 5 years old. This will be a 2-dose vaccine, and it seems to be the favored shot among parents whose children start school in the fall.
We know that boosters and a Moderna third dose are likely to come in the future, but as the parent of a child starting kindergarten at the end of summer, I would like the option of the 6-week Moderna series that shows superior immunobridging.
Pfizer was also unanimously approved for emergency use by FDA committee members. This will be a 3-dose series, 3 weeks between the first 2 doses and 8 weeks between the second and third. The safety of both Pfizer and Moderna was heavily discussed, with data presented that less than 1% of trial participants experience even minor side effects such as fever and pain at the injection site. It is important to note some of the children referenced in the study are Texans. Texas Children's Hospital took part in the Pfizer trial. But with a larger population soon to be vaccinated and broaden the chances for adverse reactions, I asked pediatric infectious disease Dr. Michael Chang how parents will know when young children who can't speak are experiencing side effects.
More irritability, fussiness, certainly any kid that complains about, chest pain or tummy pain, that can verbalize that. Decreased activity, those are all things that you want to be aware of 96 hours to 5 days of having received an mRNA vaccine.
It's not totally final yet. This is the recommendation that now goes to the FDA to sign off on, as well as the CDC will have to sign off on this too. I have spoken to Memorial Hermann and Texas Children's, our 2 large pediatric hospitals, and they tell me they'll be ready to vaccinate those under 5 as soon as they can, which could be early as next week. Lauren?